Namaskar and very good morning, my all dear student. Myself Anjum Abbasi. I am working in Calcutta's University as assistant professor. Today I am going to take your class on wound healing, which is fourth lecture. Rest 3 we have discussed earlier. So subject is fundamental of nursing and subject code is 1003. So student, in this slide you can see proliferative phase, which is also known as regenerative phase. Here you can see different layer of skin, dermis, epidermis, and the presence of extracellular matrix, fibroblast, and collagen and elastin fibers. In this slide, student, you will be knowing different stages of wound healing, different cells, types of cells, and the factor and cytokines presence there. So you can see first stage, as we have learned already, that is hemostasis, in which what are the stem cells responsible, that is hemangioblast, hematopoietic stem cell, endothelial, progenitor cells, mesenchymal stemmal cells, and next for the inflammatory phase we can see here hematopoietic stem cell, and next for proliferative cell mesenchymal stemmal cell is there, and last one is the remodeling. So remodeling, as we have learned earlier, it is coming back of the lost integrity of particular tissue or cells to its normal appearance. That process is known as remodeling. So here stem cell which is responsible for this is mesenchymal stemmal cell, and if we are learning on the basis of type of cell, so it will be fibroblast, and growth factor and cytokinins are PDGF, TGF beta, EGF and BFGF. Next, collagen are the collagen factors like type 4, type 7, type 16, 18 and 19. Next, we will be learning epithelialization. So it involves sequence of changes in wound, keratinocytes, detachment, migration, proliferation, differentiation and stratification. So migrating cells separate the desiccated scar from the viable tissue. Next student, you can see here maturational phase. As I told you, this is remodeling phase. So scar contraction with collagen cross-linking, shrinking and loss of edema occurs in this phase. Now what will happen, that scar will be shrink because it is allowing the skin which has generated in new tissue form for coming up. So once this scar has been made up there, now it will be peeling off and new tissue will be visible. So main events are scarring, contraction and remodeling of the scar. So maturation of collagen by cross-linking is responsible for tensile strength. Initially fibronectin and proteoglycan deposition occurs later, replaced by collagen. So normal skin 80% is there and granulation tissue more of type 3 collagen, and scar contains equal proportion. So wound contraction occur by centripetal movement of whole thickness of skin. Then reducing the size of disorganized scar. If wound area is very large, there may be contractures, physical limitation and remodeling. Fibroblast population decreases. So wound strength increases within 1 to 12 weeks and 3% will be at first week, 20% at third week and 80% by 12 week. So but the tensile strength will be only 30% and less elastic when compared with the normal skin. Next is keloid. So abnormal scar grows beyond boundaries of wound site and continues to grow even after 6 months. So immature fibroblast type 3 collagen can do this, and it is common in Africans, genetic predisposition, and females are these are the factors. Next is the vascularity, tender and itching, and sternum, deltoid, upper back, these are the increased susceptible. This area have increased level of muscle and skin tension. Next is hypertrophic scar. So growth limits up to 6 months. Not familial or genetic predisposed, but raised scar that doesn't extend beyond original boundaries. No tenderness, itching, and then regress spontaneously if the stimulating factor is removed. So student, in this slide you can see there is what we have learned, that after completion of remodeling phase is still that scar tissue, that scar keeps generating, you can see. So there is over proliferation, we can say. There is over proliferation that we have learned in the defect of the keloids. Next is abnormal wound healing. So keloid we will be learning. Now what will be the treatment for this? So intralesional steroids, intralesional excision, then laser make them look less red and flattened, and interferons research and fluorouresis are the treatment measure for such type of condition. Next is hypertrophic scar treatment. Same we will be seeing here. There is a regress font if stimulating factor is removed. Compression therapy, topical steroid, silicone gel sheeting over there, and surgery, laser, and topically vitamin E. Next is chronic non-healing wounds. So definition is wounds that have failed to proceed through an orderly and timely reparative process to produce anatomical and functional integrity over a period of 3 months. That is chronic non-healing wound. So what is the main causes for that? That may be because of diabetic mellitus also, and other factor will be responsible like keloid malfunctioning. So derangements in various stages, increased or decreased level of cytokines, growth factor, and proteinases. So students, here you will be learning what are the factors which are affecting your wound healing process. So we have divided into two, local and systemic. Local factors are presence of infection in your wound, then site of wound also affect, any that venous or lymph stasis is there, ischemic condition is there, tissue tension is there, poor opposition, then topical agents and ionizing radiation along with foreign bodies. These all are the factors of local factor we can say. Next is the systemic factor. It may be age, obesity, smoking, malnutrition, vitamin deficiency, diabetes mellitus, immunosuppression, and connective tissue disorder, and it may be your cytotoxic disorder also. So student, this was about the class, and it was the last lecture of wound healing. This topic we have covered in fourth lecture. So fourth lecture I will be telling, we have started with wound healing, then we have learned various types of wound healing, process, stages of wound healing, and the phases of proliferation, stages of wound healing also. And apart from this we have learned different process, and the factor which is responsible for increasing your healing process of proliferation, and the process which is deteriorating that process. So ID is anjumabbasi890@gmail.com. Thank you so much all dear students. Happy learning all of you. Thank you so much.